we can change lives just being there, helping and treating the kids and the families with love and with dignity.
You think in a total system and everybody has a part and everybody is important. So it's very equal.
Behind many successful stories, there are these passionates that really make the ecosystem run.
Ecosystems in Health and Care, the THCS Podcast.
In episode 2 of Ecosystems in Health and Care, the THCS Podcast, we discuss the desire for passionates, because transforming health and care in ecosystems is not a sprint, it's a marathon fueled by passion and perseverance. I'm talking to Sanna Tuurnas from Tampere University in Finland, who brings the analytical lens of beacon elements for ecosystems to the table. Fatima Parra from the Pediatric Palliative Care Unit in Aragon, where compassion, love, and a long-term commitment redefine what an ecosystem can be. And Pauline Terwin, CEO of Pantene and chair of the highly successful Mooi Maasvallei ecosystem in the Netherlands, a dynamic alliance built on trust, persistence, and a citizen-first mindset. I'm your host, Ursula Eising with Red Swan Vienna, Austria, and it's my pleasure to interview the lovely guests of the THCS podcast. Today we talk a lot about passion in the health sector, about passion that fuels these kind of ecosystems, about passion that is actually the basis for all of that. So Pauline, when you hear the phrase, the desire for passionates, what does it make you think of in your own work?
Well, the first thing to think of are all the employees, all the inhabitants in the region who like to live in a nice way together. And it's amazing that when you have your eye on that, you realize how normal it is to live together in a nice and friendly way, but also in a healthy way, and how difficult it is to make also the work in healthcare and in municipalities bring it back to normal. To ask yourself the question, what can we do to help our inhabitants, to give value to the inhabitants? And in the systems we live in now, we are far from that question most of the time.
The desire for passionates, what does it make you think of in your own work? Fatima.
Well, I think in my job, you have to be passionate because you work with children and families that they are in pain because their child is going to die. And you have to be passionate to help them and to know you are the person who can help them to take through that moment. And sometimes you don't have time in your journey to be with them, but you take time to be with them because they need it. So you must be passionate to help them and take care of them.
Absolutely. I think so too. Do you want to add anything, Sanna?
Yeah, I think that when we talk about passionates, I think they are everywhere. And for me, from my perspective, I think we as researchers also share different types of passion. And for me, there has always been a passion for creating and understanding this collaboration dynamic. And of course, this ecosystem work that we are now doing in the Transforming Health and Care Partnership is a really interesting opportunity to really dive deeper into this topic. And what is more, I think now we have been hearing and talking with a lot of ecosystem actors, and I can really recognize that behind many successful stories, there are these passionates that really make the ecosystem run.
We call this whole episode the desire for passionates. What makes ecosystem work? Spoiler alert, it's not only the money. So my question for you, Sanna, if ecosystems don't run on money alone, what do they run on in your experience?
Yeah, that is a very good question. I think what we see behind this kind of the stories, what we hear about the different kinds of ecosystems, it's also a lot about shared commitment. Then always the word trust comes up. Of course, that's very easy to say, more difficult to create and build. But that's something that is always mentioned as a kind of a key defining element. but we have been able to recognize that there is this shared sense of urgency that also brings people together. So saying that, I mean, come on, I mean, we have to do it. We didn't have any alternative. We have to collaborate. We have to build these ecosystems. Otherwise, the system will collapse and we are not able to work. We are not able to find workforce, and it just becomes too expensive. If we would say that it's only about the money or that the money is running everything, it would be a bit way too narrow.
It's a lot about trust and a lot about passion. So, Pauline, what do they run on in your experience?
Well, you talk about passion. That's not the word I use. The words we use is that we need trust between all the employees, trust in what you're doing and what your colleague can add to your work, trust in being consistent in our actions. So we know what we are doing and don't change that every month. You need persistence for everybody who's looking at you and who has a part. Involve them, but don't get away from what you think is the best to do. And well, it's necessary that you stay together, that you're bonded together, and that you include everybody who works in the region. So you don't think in big or small. You don't think in, well, it's not my type of person. You think in total system, and everybody has a part and everybody is important. So it's very equal in working together.
Fatima, I think pediatric palliative care is really a special field. So, of course, money alone cannot explain success or your passion. What role does long term passion, persistence, perseverance, and commitment play in making your unit an ecosystem?
Well, I think the word that can define this is love. Really, love between the team. No, I think building a team is a job, but when you build it, it's very grateful and is needed for this job. And love between the partners, love to the patient and the family, and then listening to the families needed and the thankful they are for our job because they help us keep working on that and everything. As you say, money cannot pay what we do. I always say we are not paid enough because we do more than money can give us, but we paid with another coin that is love and the value that they gave to the patients.
Wow.
Mm.
Can you recall a moment of pure passion from a partner, a citizen, or your team that kept your ecosystem alive?
Yes, well, I have a lot of moments because when I work together with my partners, we have very stressful moments when sometimes we say, I'm going to give up. I'm going to give up this job because it's so painful for us to be there with people that die every day and kids that they can be from 1 year to 17, 25 years. So it's really kind of stressful for us. So I remember a moment where a mother told us that in the last days and well, last hours of the life of her son, he thought that moment was going to be a very dark and very bad moment. And she told us that thanks to us, she can recall that moment with love, with dignity, and beautiful moments. And for us, when she told us, she called to say thank you and to say thank for being there. So I can remember these days with beauty. No, and when she told us, I was like, oh my God, when a mother can remember the last days no, of the life of her children with beauty, it's helped us a lot to keep working on this because it's so beautiful no, that we can see we can change lives just being there, helping and treating the kids and the families with love and with dignity.
Can you recall a moment of pure passion from a partner, a citizen, or your team that kept your ecosystem alive?
Well, I don't have one moment. We have moments every day. because we started 9 years ago by bringing people together in the same vision of how we can create value for the inhabitants. And the interesting part is that when you give that vision to your employees, then they are allowed to work together, not only with the colleagues they have in their own sector, but working together in the region for what is the value for the inhabitant. And the best part is that the employees are telling you, or the inhabitants are telling you, what it brings them. So that are the passionate moments that you hear that they found out how they can do it in a smarter way, how they can work better together, how they have other results than you normally see. And that gives passionate moments.
Do you want to add anything, Sanna?
Yeah, I think that now we have been hearing and talking with a lot of ecosystem actors, and I can really recognize that behind many successful stories, there are these passionates that really make the ecosystem run.
How do we turn this relational capital, one of the less visible elements, into something strong enough to keep ecosystems alive when funding is uncertain, Sanna?
The continuous interaction and openness are, of course, very, very essential. That you keep up the interaction, and also when there are conflicts, then you kind of have this atmosphere where you can kind of talk about the conflicts and overcome.
Sounds amazing. I was told that Mooi Maasvallei was just awarded major funding to grow and scale. Congratulations to that. Does it feel like your good work was rewarded and with recognition? And your good work actually was also turned into monetary resources?
Exactly what you say. We felt the recognition by getting the money. We worked hard for that because the money was first of all used for healthcare transformation. But we said, well, if the municipalities are not involved in the total amount of money, we don't want to have the money, because we think so strongly that you have to work together on vital inhabitants, the helping them by staying vital. You can't do that only from healthcare. You need what the schools does for their children. You need what the entrepreneurs does for their employees. You need the municipalities to look for the environment for the inhabitants. And of course, you need healthcare, that if there are questions, you give the best care, but help people to stay as long as they can at home and staying vital. So it was the recognition that we got the money. It's still interesting that we didn't get it for new plans. We didn't have new ideas. We already had the plan and the ideas, and now we can scale it up.
That sounds really, really promising. And we heard that a lot, that the real beacon ecosystems, they work long term. You just mentioned you started like 9 years ago. Can you walk us through your journey? How did it all begin?
It begins with the feeling that you can do better than what you are doing at the moment.
Right.
And we have an urgent problem, namely that the growth of health is doubling in the next 5 years, and we don't get more employees. So you have to find a quicker, a better way of working together. And 9 years ago, well, we sat with all the parties together, from municipalities, from the schools, from the entrepreneurs, and also for healthcare. Well, what can we do better together than we do on our own? And that was the beginning. So we need each other to make difference for inhabitants, because we can't do it by ourselves. That was the real insight. So I started to invite my colleagues and ask them what they're doing. And together we build the vision of what we can do better together than what we are doing on our own.
But coming back to the money, because of course it's nice to say we need passion, not money. So we see it's also not entirely true, right? All your commitment, can we say that actually all your commitment and your good work attracted the resources you need?
Well, maybe. I think it's difficult to ask for money if you don't have a good plan and you can't tell what you want to achieve. And now the money we got helps us to scale up and make the change a bit quicker working out than, well, if we didn't get the money.
Yes. And for scaling and growth, you need the necessary resources in one way or other.
Yeah, but without the money, we should have done the same, only in a bit more slowly than we do now.
Yeah, yeah. So it's faster. You can scale faster, but you would have done the same. Maybe that's also the point. You would have done it anyways because there's need, there is your commitment, there is all the vision you have, and it sounds like a real solution to the problems we have in healthcare systems all over Europe. What's your turn on that, Sanna?
What was also described earlier is there are other factors than money that are very important, like the shared commitment and the trust. And as we hear also from Fatima, in the end, it's the people who run the ecosystem and make them work. There is also not very easy solutions how to kind of turn this relational capital into something long-term work, but somehow it then still happens. And I guess then when you have these passionates, when you have the people who do it for love, I think it's what can be done is to really support them in their work and not at least build obstacles, doing things in the way that really help the patients in the best way. So I think, for instance, that really can help the passionates.
Yes, that is true because sometimes from the policy and everything, they only bring us obstacles, and we are like all the time, yes, and again and again, and we're fighting not with the clinical issue, but with the policy and with the big
Administration.
and that burns us a lot. So sometimes, no, we are
How
burned.
do you not get burned out?
Well, that is a good question. My boss always says that you have three items that you have to complement. That is one, you have to have life out of the hospital, like love your family, do some sports and everything. You have to take care of yourself. That is very important. And you have to face death every day, your own death, not the other's death, but your own death, because everyone, we are going to die. So you have to say, well, maybe today is me, and what would I love to do today if I die? No? And do it, because that is the point. No, we live because we want to change the world, and we want to change ourselves. So what you would like to do if you die today?
Right, excellent question. Do you want to add anything?
No, I wanted to return still to the relational capital. One thing that I also wanted to mention is that people are the ones who run these things, but then if somebody decides to go elsewhere, it can be a catastrophe for the ecosystem. But then I guess that when you have built up this support and trust and this commitment, then it's still possible to overcome such little catastrophes that may occur when we talk about these type of activities that are so people-centered.
Right, but then you also need to see the results and the vision you talked about, the structures you created, and to have this trust and security also that it doesn't just vanish. I invest my energy and then it vanishes. Pauline, what do you think about that?
Yeah, so it's necessary to see each other very frequently. We see each other every 6 weeks, and then we talk about what we achieve, what we need to do, questions from employees we have or from inhabitants. We have new ideas. So we bring it together every 6 weeks and we try to build, yeah, on the ecosystem.
Communication is key also, and to really meet. Do we meet in person or is it
Yeah.
okay to?
No,
Yes.
in person.
Yeah, also very important point. Partially, we are over digitized, and people really, really need to meet in person and see each other face to face and talk about these things.
If you don't see each other in person, you can't feel and
Right.
smell how it is with your colleague. And that's necessary when you need to trust to do things you're not used to do. Every time,
Absolutely.
every 6 weeks, we make choices we have never done before. So it's
Wow.
necessary that you can look each other in the eyes and see, well, I think this is the good part. It's scary. We don't know exactly what it will bring us, but well, let's do because we think that's the best to build on the system, on the ecosystem. We think this is the best for the inhabitants, or this is what the inhabitants ask. We don't know if it will work, but let's try it. So you have other questions and you have other way of working together.
Yes, and that's a perfect segue to my next question for Fatima. When families are at their most vulnerable, how do you and your partners build the trust that really makes the ecosystem work for you?
Well, I think here the word is to listen, no? To listen what they want, what their values are, and respect them. Because sometimes we think the right thing is A, but the family knows their family system, their values, and say, but no, for us, the right thing is B. So we talk and we say, okay, we're gonna do an AB thing, no, or something like that. So we can trust and build the ecosystem. I think that the word is listen and to talk with the patients and the families.
Absolutely. So if this isn't passion and if this doesn't work, I don't know what could. So Sanna, one more lesson about making ecosystems work that you want Europe to remember.
I think it's very difficult to say anything after Fatima's.
Absolutely right.
If we listen to people like her, like Fatima, I think it's like we can really hear this strong commitment and also the
Passion
the passion,
and the
yes,
love.
yeah, and the love. But also you talk about that you listen to the families. But if we would kind of transfer that to the slang of the European Union, we would talk about user-centered approaches.
Yes.
But this is it in reality, and what also many of our other ecosystems are doing, that they want to build up their processes listening to the people who use the services, and also not just individuals but also the patient organizations. So I think that really pays off, and also not just users, the patient organizations, but also the people who are in a close connection with them.
Pauline, one lesson about making ecosystems work that you want other European ecosystems to remember from you.
It makes your work so much attractive if you know what your neighbors are doing and if you
Mhm.
can connect with your neighbors, neighbors in healthcare, but also neighbors in municipalities, your GPs in your region, also the inhabitants. People can tell you what they expect, what they need, what makes them happy. Somebody speaks about happiness. Well, I think that's a very difficult phrase, but yeah, ask people how you can help them. And if you see that from the hospital side, they say, well, I want to be helped at the moment that I'm ill and I want the best care, but I really want to be helped to get home again and live my life there. So you get another perspective by having interest in your colleagues and in what the inhabitants ask you. And that makes the change.
So, Fatima, what is one lesson about making ecosystems work that you want Europe to remember? I think they will remember your talk. I certainly will.
Sir, I think like a phrase I can remember the next generation. You don't have to only measure the things for the normal outcomes, but measure it with love and dignity and hope, and make the expertise trouble, not the family trouble. Because as you said before, no, I travel to the family's home and the patient's houses so the patient doesn't come to the hospital. No, so I think we have to get more near where the patient is. So expertise must trouble more than the family has trouble.
Sanna, is there one myth about money in ecosystems you wish to bust?
Well, yeah, I'm not sure if there are very strong myths about money, but of course, we sometimes hear that we cannot do it because we don't have the money. And this is not my statement to say that there is no need for money, because it's even if there would not be kind of extra money, then always these collaborations, they might cost more in the way that there is, like, especially in the beginning of building up different types of ecosystem based collaborations, that might require some extra time resources of the professionals, and that's of course away from some other activities. But I think if we would kind of diminish the functions of the ecosystem and what's the key thing, if we would only say it's the money, that's rubbish.
Fatima, one message from your ecosystem to inspire the next generation of passionates.
Love your job and love the people you work with.
Is there one message from your ecosystem to inspire the next generation of passionates? How we call it? You already told me you don't like the word, but to inspire the next ecosystem that works as beautifully as Mooi Maasvallei.
Well, in my opinion, everybody is working together with their colleagues and connected to inhabitants. If you want to start, try to find out where it happens already. So start looking around. Start visit inhabitants. Start visit your employees and walk with them and listen to what they achieve, but what they think you can do better. Broaden your perspective. That's the start. The most difficult start is the change your own person.
Yes, you have to start with yourself, right?
Yes.
With your perspective, gaining new perspectives, then collaborating with others.
Yeah.
Look around. I like that. Look around
Yeah.
and collaborate with your neighbor. Look what they need. It always sounds so simple, right? When you describe it, it sounds simple, but I know this is a lot of work. It takes a lot of dedication, and you have a lot of vision. You created structures, you have regular meetings, you invest everything to create this, and it seems to be creating also fantastic results and a real beacon, a real ecosystem everybody could learn from. I hope we really take this as an example and start things like that all over the world. Is there anything else you would like to leave us with?
It can be today the day that you make the change. It's a question of really living together in sort of other perspective. And only if you feel that, you can help that change and grow. There is written enough of what are the problems, but there's very less written about how can you make the change. So it's nice that you make this podcast. Hopefully it will help people to start today or recognize what there's already happening. There's no reason why you don't start today by having interest in the people around you. And there are 1,000 reasons not to start it. There's only one reason to start, and that's really in yourself. If you want to make the change, you start today.
I think this was a podcast full of love, connection, and passion. It did our title due and much more. Thank you very much. It was a pleasure talking to you. I think this was really goosebump moments. I can feel the passion, I can feel the love, I can feel the connection. So I think you are everything that's right about the health and care system. Thank you very much for being a guest.
Thank you.
Thank you.
You've been listening to episode 2 of 6 of the THCS Podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time, THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation, it's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS Podcast.